I'm Erika Mumford, and this is the treatment group video for Doug Foster. Doug Foster is a 37-year-old married accountant with one child, and his life has been fairly normal aside from the fact that 2 years ago, Doug's daughter had a heart surgery. The surgery was successful and she made a full recovery, but Doug has had constant anxiety since her surgery. Doug isn't able to control this worry, and because of that, he's had to leave work early and turn down multiple social events to the point where he's not invited out anymore. And he fears that this will cause him to be fired or to be divorced by his wife, despite both his wife and his boss constantly reassuring him that they don't mind and nothing's wrong. The only differential diagnosis I really considered for Doug was generalized anxiety disorder, because the primary diagnostic feature is constant worry, which is the root of all Doug's issues. There are 5 diagnostic criterion for generalized anxiety disorder. Criterion A is that the client experiences excessive anxiety or worry for more days than not for 6 months or more. And Doug explained that he's been anxious and worried nearly every day for the last 2 years since his daughter's surgery. Diagnostic criterion B is that the client experiences the anxiety or worry as difficult to control. Doug mentioned that he's tried multiple things ranging from diet and exercise to meditation to control his anxiety, but none of them have worked and he still feels really powerless. Diagnostic criterion C is that for the past 6 months, the client experiences 3 or more of the following symptoms when anxious or worried: agitation, becoming tired easily, trouble with concentration, irritability, muscle tightness, or sleeping difficulties. Now, Doug does mention being agitated easily and irritable. He doesn't mention becoming tired easily, but he does say he is up all night because of his anxiety. And he mentions muscle tightness and trouble with concentration, which ultimately cause him to leave work. So that's 4. Diagnostic criterion D is that the client experiences significant distress or impairment in functioning as a result of these symptoms. And yes, Doug has had to leave work multiple times because of his anxiety. His wife and him are no longer invited out, which is distressing. And finally, diagnostic criterion E is that the client's symptoms are not due to substance use, a medical condition, or another mental disorder. And no, there's no apparent drug use or pre-existing condition. As for the multi-axis diagnosis on axis 1 clinical disorders, I place generalized anxiety disorder. For axis 2, there are no personality disorders present, so I said none reported. Same for axis 3, no medical conditions reported. And on axis 4, psychosocial environmental factors, I thought it was important to note that Doug's daughter had a heart surgery, because that's when his symptoms first began. And finally, axis 5, I gave him a GAF score of 68 because the anxiety is a very dominating force in his life but hasn't completely stopped all of his functioning. I considered 4 theoretical perspectives, the first being the biological perspective. Doug's anxiety may stem from his sympathetic nervous system being overstimulated, causing it to produce too much norepinephrine or cortisol, but not enough GABA. There may also be a deficit of serotonin, which could be inherited. There's a genetic predisposition for that, and that could definitely be causing some of Doug's distress. Secondly, the cognitive perspective. Doug's unexplained irrational belief about his daughter's health, marital status, and job security could be causing the symptoms. These are automatic thoughts that would be troubling. And thirdly, the behavioral perspective. Doug could have been classically conditioned. He may have made a learned association between his daughter's health, his marital status, his job security, and the bodily anxiety that he experiences. He may also have been operantly conditioned. He exhibits avoidance behaviors when he has to turn down social invitations or leave work early, which negatively reinforce him. And lastly, the psychodynamic perspective. Doug is probably repressing his stress about his daughter's condition as a coping mechanism, and it's just manifesting itself as anxiety. All right, thank you.